532 nanometer laser, which is incorporated in the VariLite laser, is extremely versatile and useful in my practice. We use it for treatment of multiple problems. We use it for treatment of telangiectasias. Approximately 30% of the Caucasian population has telangiectasias and they want them removed. We also use them to treat the vascular blush and pinkness associated with rosacea, which we can reduce but not completely remove. We use it to treat the brown spots, lentigines, that patients are very unhappy with. We also use it to treat acne breakouts, in which case it can reduce a lesion almost overnight.
Talk about just some of the benefits of 532 as far as no bruising, low complication rate, high patient satisfaction, predictable outcomes.
The 532 nanometer laser has resulted in great patient satisfaction. Immediately after treatment, patients see blanching of telangiectasias, and they're very happy because I give them a mirror immediately and they see that the lesion is gone. When they don't see their vessel, that makes them happy. We also find that patients have some minimal pinkness afterwards, but it's very acceptable to patients, and it's usually gone within a few hours. Patient satisfaction after treatment with the 532 nanometer laser is also enhanced by the fact that there is no bruising after treatment with this laser. Once in a rare blue moon, someone gets a little bit of minor swelling, but they do not have bruising. Therefore, they can resume all of their regular activities. Patients leave this office, they can go out for dinner that night, they can go back to work. The 532 nanometer laser, which is included as part of the VariLite laser, has been a great addition to my practice. It has a very predictable outcome, an extremely low complication rate, and a great rate of patient satisfaction. After treatment with the laser, patients have some brief minor pinkness, which resolves usually within 30 minutes to a few hours. However, there is no bruising. Since there is no bruising, the patients can immediately return to their regular activities, then go out to dinner or go back to work. It also has the advantage that when the treatment is completed, I can give the patient a mirror to look into, and they will see that their vessels have been removed. This results in a great amount of patient satisfaction. The VariLite laser is a very versatile laser because it contains two wavelengths. The 532 nanometer laser can be used to treat smaller vessels, up to about 350 to 500 microns in diameter. For larger vessels, you can use the 940 nanometer laser, which is also contained in the same box. And this will be used to treat the larger vessels up to about 1.5 millimeters in greatest diameter. Having two wavelengths in the VariLite laser is extremely useful in my practice. We treat the smaller vessels with the 532 nanometer component. We treat the larger vessels with the 940 nanometer component. In this way, when a patient enters my office, I'm able to treat most of their facial vessels. The 940 nanometer is also useful for the deeper, bluer vessels, and it also obtains better results in spider angiomas than the 532 nanometer laser. The addition of the 940 nanometer wavelength to the VariLite laser adds a whole new dimension to the treatment parameters that can be used and the pathology that can be treated. With the 940 nanometer laser, you can treat larger, deeper vessels without any bruising or ecchymosis. This results in a lot of patient satisfaction, as with the 532 nanometer wavelength, because there is no bruising, so they can resume their normal activities. The 940 nanometer laser is extremely effective in treating larger, deeper vessels, including some of the blue vessels on the face. It is also very effective in the treatment of spider angiomas, as well as pyogenic angiomas. This adds a whole new dimension to what you can treat with the VariLite laser compared to the 532 nanometer laser alone. The VariLite treatment has minimal associated discomfort. When you have treatment, we will cover your eyes with protective goggles so that the laser cannot hurt your eyes. We'll ask you to keep your eyes closed underneath. You will feel like little tiny pinpricks. It's sensitive, you're aware of it, but it's not really very uncomfortable. After the treatment, you'll have a little bit of pinkness, which will go away within a half hour, and some people will last up to a few hours. You will see that your vessels have a dramatic improvement. Once in a while there's a vessel that does not respond, but over 90+% of vessels overall will respond. So after treatment, what you will see when you look in the mirror is slight pinkness from the laser treatment and disappearance of your vessels. Before we start treatment, we will put a clear gel on your face that the laser beam goes through. This helps protect your skin. It feels a little cool and a little moist. We'll then cover your eyes with protective eye shields, and we ask you to keep your eyes closed under the eye shields. During the course of treatment, you'll have minimal discomfort. We'll then remove the eye shields, and you can look in the mirror at your skin. Typically, immediately after treatment, you'll note some pinkness of your skin if we've been treating vascular lesions. In many patients, that pinkness will resolve within half an hour. In others, it will last up to 3 to 4 hours. Rarely, people are pink the next day. When you have a pigmented spot treated, you'll know that the spot looks a little bit darker after treatment, and that indicates you're having a good response to the treatment. That dark area will stay there for a few days, possibly as long as 10 days. It will then come off, and the pigmented spot will then be lighter, and you should note a good improvement. Typically, after treatment of either vascular lesions or pigmented spots, you can immediately return to all your activities. There may be some minimal pinkness, there may be some minimal swelling, but this is typically minimal and not noticeable by the average person you meet. There will not be any bruising. Laser treatments treat the result of a process that your body is doing. So if your body is making your skin red, or if your body is making blood vessels, the laser is not going to stop you from making more of those, but the laser treats the result, which is the problem that you see. With each treatment, you should note significant improvement of the vessels with less vessels, or the vessel may be completely gone. Typically after treatment, you'll note a small amount of pinkness that will last anywhere from 1/2 hour to 4 hours. Rarely, it will last until the following morning. If you had a pigmented lesion treated, this will be dark and the crust will come off in 4 to 10 days. You will not have any bruising or ecchymosis. Now, typically after treatment of blood vessels on your face, you will note that the vessel is completely gone. Your body may remake the vessel, and some patients will require a second treatment. In my experience, approximately 20% of patients will require a second treatment. In performing your treatments, your doctor must use safe laser technique and parameters. Therefore, there may be a limit to how much of your problem can be treated at any one time. Your doctor will determine this, and you may require a second treatment to treat the problems that are still left. One purpose is to reduce fine lines and wrinkles. The second purpose is to reduce the overall pinkness and improve the smoothness of your skin. And the third purpose is that if you're breaking out with acne lesions and they're not responding well to medication, a treatment with a ScanLite laser typically will reduce many of these lesions overnight. When the ScanLite is used to improve the appearance of your skin or to lighten the overall pinkness of your skin, it requires more than one treatment. Typically, patients will have to undergo a series of about 4 treatments. As your body continues to age, regardless of any treatment that is performed, you will note that over time, some of your lines and wrinkles will return. The smoothing of a skin surface is not permanent because the normal factors that cause photoaging of your skin will continue, and so retreatment will be necessary. Typically, patients start out with a series of 4 treatments. Patients can come into the office, show me their problem, and I can immediately treat them with a high rate of patient satisfaction. In this way, it does not require a lot of marketing. 1/3 of the Caucasian patients who walk into your office typically will have facial vessels, telangiectasias, and/or pinkness, and will be unhappy with their presence. The fact that you can offer them immediate treatment without any bruising and minimal discomfort is a valuable addition. Each physician has to decide how they want to perform marketing in their practice. The VariLite laser is easy to use with a high rate of patient satisfaction. Therefore, minimal marketing is necessary. In our office, we use brochures, and also we use some external marketing, and we always mention the VariLite as part of our external marketing program. If you're starting to use lasers for the first time in your practice, the VariLite laser is an excellent place to start. The laser is relatively straightforward in terms of how to use it. It can be used quite quickly, and it has a minimal complication rate. Also, since 1/3 of all Caucasian patients have vessels on their face they are not happy with, you have a ready population available to be treated. The VariLite laser is a great addition to any practice in which you perform cosmetic or laser procedures. It can be used to treat all types of vascular lesions as well as facial acne and lentigines. It can be used quite quickly and simply. It does not require much marketing and has a high rate of patient satisfaction. The VariLite laser has been extremely reliable in my practice. I have had a VariLite and its predecessor, the DioLite, in the office for over 5 years. In 5 years, we have never had a laser failure and never needed to replace the diodes or send the laser out for repairs other than routine service checks. The VariLite laser is very user-friendly. It is relatively easy to use, relatively straightforward, has a low rate of patient complications. It has a small size. It can be readily moved from one room to another without problems. It can even be transported in its case from office to office.